We all know that Maldives is a famous tourist destination. The other truth is that Maldives also has a high incidence of thalassemia. SPARSH Hospital Yeshwanthpur has this unique program wherein the experts in the field of hematology like me visit Maldives periodically and screen these patients who are eligible for bone marrow transplant and have a one-to-one discussion with the patient and the caregiver explaining regarding the procedure.
Hi, my name is Mariam. I am from Maldives. I was diagnosed with thalassemia at the age of 6 months.
Mariam, for the first time in Maldives, she was a 25-year-old young lady who came with thalassemia. So she was diagnosed with thalassemia at a very early age, like most of them at 6 months of age, and she was on regular blood transfusion. There is a lot of iron overload that can happen, for which there are some medicines that she was taking, which was keeping her iron load to the lesser possible value. At present, the only curative option for this dreadful disease is bone marrow transplant.
Good to know that bone marrow transplant is the only curative option for thalassemia. We didn't know where this procedure could be done or how it is going to be done. But fortunately, we met with Dr. Anand.
Mariam and her family understood and made up a decision that to get free of thalassemia, bone marrow transplant was the only curative option. So let me tell you that bone marrow transplant in thalassemia should be ideally done in an age group of 2 to 7 years, with the iron overload being the least. That means we have a best chance for transplant outcomes and least chances of life problems to the patient. But here in this scenario, with Mariam being a 25-year-old and having a lot of blood transfusions from a very young age, and secondly the iron overload being high, and also the endocrine and other complications that could have already occurred in Mariam possess unique set of complications that could arise from these during the transplant. So all these things were discussed with the patient and the family.
After Dr. Anand explained all the complications about the transplant, we were all quite worried about the outcome. We didn't know what to do.
They were given enough confidence that we have a expert hematology team and a well-equipped super specialty program at SPARSH Hospital Yeshwanthpur.
From there, we learned about SPARSH Hospital in Yeshwanthpur and how advanced the facility is for bone marrow transplant.
So when Mariam and her family came to us in June 2024 to SPARSH Hospital Yeshwanthpur, we had a detailed discussion with the patient and the family about how we will go ahead with the transplant. The foremost thing that I had a discussion was to bring her iron load to the least, and this we did with the help of few medications, which the patient was very compliant and took the medications very diligently. And the second part was since these patients have got a lot of blood transfusions, they have a lot of immune system which is very hyperactive. The problem with such a hyperactive immune system is they could reject the donor cells, stem cells, when they are during the transplant.
We were quite worried and confused about the treatment. With Dr. Anand, I got a lot of hope, and his explanation was very encouraging. And we had two options: continue the blood transfusions and chelations, or take a brave step and do bone marrow transplant. I got the confidence to do the bone marrow transplant after the explanation from Dr. Anand. We took the step to do the bone marrow transplant. To get bone marrow transplant done, we needed a matching donor. So we tested for HLA typing, and I luckily got a fully matching donor who was my brother.
After we got to know that I was a donor, we went with the decision to get rid of the disease for her and get her cured from this disease.
From there on, all the family members agreed and wanted to do the transplant.
So Mariam diligently followed all our instructions, and once our team felt that her iron levels were within the normal limits and she had undergone this pre-transplant immunosuppression, we took up her for bone marrow transplant, with her brother being as a complete match family donor. Before the transplant itself, we had a discussion with the patient and the family about this unique complication known as veno-occlusive disease of the liver, which is a very common complication that we see in thalassemia patients, mainly because of the iron overload. But in Mariam, we expected it to almost happen. We preempted the situation, and the unique drug that is available to saver from this complication is known as defibrotide. It's not available in India. It has to be procured from abroad, and the turnaround time is around 2 weeks. So the hospital had to make a decision to get this high cost drug, which costs about 10 lakhs from abroad, and keep it ready even before the transplant. So the hospital administration agreed for it, and we went through the procedure. We procured the drug and we started the transplant procedure. As expected, around day 6 to day 7 of that post-transplant, she developed this complication. Luckily, we had this drug already in the medical stores, and we could give this drug and save her from this complication. And finally, she engrafted, and her transplant became successful. But she had to undergo a lot of complications because of the age and high-risk thalassemia that she had. But with the help of the medical team and the expertise at SPARSH Hospital, Yeshwanthpur, we were able to provide her with new thalassemia-free life.
During the ICU stay, all the nurses and doctors, everyone took care of me very well. Me and my family were quite worried at that time. I was facing a lot of complications, breathing issues and a lot more issues. But the nurses reassured that everything's going to be fine. So they gave me a lot of hope.
So after facing all this setback, the transplant was successful, and she was discharged from the hospital. Post the procedure, she recovered well. She had very few minor issues, and at present she is almost 3.5 months post-transplant, doing very well. Her blood counts have recovered. She has not required any transfusion. At present, she is fully fit to travel back and lead a new life, which is thalassemia-free.
It's been 3 months post-transplant and I'm feeling a lot better. Trusting Dr. Anand and his team and coming to SPARSH Hospital was one of the best decisions of my life. Getting blood transfusions for my whole life, every month going to hospital is very difficult. I have missed a lot of school also because of it. Finally getting the transplant and living a normal life, it's like a dream come true. For anyone suffering from thalassemia, they shouldn't have a second thought when they meet the right doctors and the right center. They can have a thalassemia-free life. I really thank Dr. Anand and the entire team and SPARSH Hospital, Yeshwanthpur.